Welcome back to Understanding Human Anatomy in part 4 of our discussion of the vertebra. We're going to talk about ligaments associated with the vertebra. The first one is the anterior longitudinal ligament. It runs along the anterior surface of the bodies of the vertebra. It starts at the base of the skull and runs all the way down to the sacrum. Here it is in the view from on top, and on the left-hand side of the screen, the lateral view. The anterior longitudinal ligament. Then we have the posterior longitudinal ligament, which runs along the posterior surface of the vertebra. And it would be in this position. It actually runs through the vertebral canal. So where our view is interrupted by the pedicle, I have to stop drawing. In the view from on top, this ligament is in this position, right here. The posterior longitudinal ligament. The posterior longitudinal ligament. And that would be here and in the other diagram right there. The anterior and posterior longitudinal ligaments support the bodies. They keep the bodies of the vertebra from shifting anteriorly or posteriorly and holds everything together. In addition, they reinforce the annulus fibrosus. Now, this means that when the nucleus herniates through the annulus, it is most likely to herniate in the area between the coverage of the anterior and posterior longitudinal ligament. In other words, in this area, or in the corresponding on the other side. This This limits the areas through which the nucleus can herniate, but unfortunately it forces the nucleus to herniate directly at and onto the spinal nerve as it's exiting the vertebral canal through the intervertebral foramen. There are ligaments between the laminae, and these ligaments are called the ligamentum flava. The ligamentum flava runs from the lamina of one vertebra to the lamina of the neighboring vertebra. If we look at it on the view from on top, the ligament would be in this position along the lamina. The ligamentum flava. The ligamentum flava is a unique ligament in that it is composed primarily of elastic tissue. It's an elastic ligament. This allows the vertebra to move relative to one another, the lamina to move and separate and increase the space between the vertebra in the laminar region. And this is the mechanism by which the vertebral column is able to flex, to bend forward as you bend over. Now, there are a couple of other ligaments I'm going to mention. There is the interspinous ligament, and that is a ligament that runs between the spines of adjacent vertebrae. I'm drawing it in here. And it just helps hold the spines together, keep them from separating too far. And over on the view from the top, this ligament would be right here. The interspinous ligament. In addition to holding the spines together, the interspinous ligament also serves for muscle attachment. So muscles can attach to that ligament as well as to the spines themselves. The last ligament that we're going to talk about is the intertransverse ligament. The intertransverse ligament, which stretches between the transverse processes of adjacent vertebra. The intertransverse ligament. And again, on the view from the top, is here. And there. Intertransverse. Ligament. And it prevents excessive movement between the vertebra and also can serve as muscle attachment. These are the major ligaments of the vertebral column. There is an intervertebral disc. To summarize what we have discussed with the vertebra, the vertebra are formed by the body, the pedicle, and the lamina. They form a bony ring that encircles the spinal canal. And the spinal canal contains or houses the spinal cord, part of our central nervous system. There are processes projecting from the vertebra, a spinous process posteriorly, two transverse processes laterally, a pair of superior articular processes, and a pair of inferior articular processes. The superior and inferior articular processes form a synovial joint between adjacent vertebra that permits movement between the vertebra. the intervertebral disc. That is formed of a annulus, fibrosus, and a nucleus pulposus. The annulus surrounds the nucleus. It attaches to each of the bodies of adjacent vertebra to form a symphysis type of joint. There is, running the length of the vertebral canal, an anterior and a posterior longitudinal ligament. These ligaments act to hold the bodies in place, prevent them slipping anteriorly and posteriorly, and reinforcing the annulus. It is also true that because they reinforce the annulus, when there is a herniated disc, it herniates through the areas not reinforced. So that would be the lateral aspect of the disc. And that allows the nucleus pulposus material to push onto spinal nerves, causing pain. There are spinous ligaments between the spinous processes, and transverse ligaments between the transverse processes. These ligaments act to limit the amount of motion between adjacent vertebrae, between their transverse processes and between their spinous processes. There is a ligamentum flava. This ligament is an elastic ligament. It's composed primarily of elastic fibers, and it allows flexion of the spinal column while maintaining the integrity of the spinal canal. This concludes our discussion of the vertebra. Thank you for your attention.